Hello everyone. Now I'll be presenting a seminar on retinopathy of prematurity, that is ROP. ROP is a disease occurring in the prematures who develop abnormal retinal vasculature. Now, before coming into the pathology, we will see the normal development of the retinal vasculature. The normal development of the vessel starts from the optic disc and grows towards the periphery. The vessels reach the nasal ora by 36 weeks and the temporal ora by 40 weeks. We'll see a diagrammatic representation. This is the retina, the right retina. This is the optic disc and this is the fovea. The vessels start growing from the central disc, optic disc, and they reach the periphery. They branch out and reach the periphery. This is the temporal ora and this is the nasal ora. To reach here, the vessels take 36 weeks. And to reach here, the vessels take 40 weeks. So this is the normal development. And the overall normal vasculature will look something like this. This is the normal development. Now, in the babies who are delivered before 36 weeks, that is the premature, they have immature retina. That is, most of the retinal part is avascular. That is, the retina is hypoxic. This hypoxic retina will in turn produce large amount of VEGF, that is vascular endothelial growth factor, causing abnormal vasculature. Now, we will see the pathogenesis. In the premature birth, when the baby is born, there is very low VEGF production, hence the vessel migration is inhibited. The vessels won't migrate to the periphery. Now, in the further growing age of the infant, the hypoxic retina will produce growth factors such as VEGF, which is oxygen regulated, and also insulin like growth factor 1, which is non-oxygen regulated. Due to action of both these growth factors, there is neovascularization and abnormal fibrous proliferation of the vessels, and this leads to abnormal vasculature, retinal vasculature. It will look something like this. This is very bushy and thick, fibrous, and this is the normal one. You can compare the two, the normal and the abnormal. Okay. Now coming to the risk factors. The first and most important risk factor is the gestational age, that is less than 32 weeks. It is a risk factor. Next comes the low birth weight, that is less than 1500 gram. And next comes exposure to oxygen, high concentration of oxygen. As the prematures are given oxygen therapy, it becomes a risk factor. So now to reduce this risk, less than 30% concentration of oxygen is given to the prematures. Next is sepsis, blood transfusions, and twin delivery. So now what is ROP? The definition of ROP. It is a bilateral, it occurs in both eyes, bilateral, proliferative disease occurring in the premature infants who have low birth weight and are exposed to high concentration of oxygen. This is the definition of ROP. It was also called retrolental fibroplasia in the past. Okay. Now coming to the clinical features of the ROP. Under clinical features, we will see the stages, the zone involved, and the extent of the disease involved. Now coming to the stages is given by ICROP, that is International Classification of ROP. In stages, we have 5 stages, that is 1 to 5. The first stage being, there is clear demarcation line between the vascular and the avascular retina. We will see a diagram here. This is the vascular retina. This is the vascular retina, this is the avascular retina, and here we have demarcation line. This is a demarcation line, just a 2D line that demarcates the vascular and the avascular retina. This is stage 1. We have a fundoscopic image here. This is the demarcation line, this is the vascular and the avascular part of the retina, and this is the stage 1. Now coming to stage 2. In this, the demarcation line which was there in the first stage, it will progress to a ridge. It will form a ridge. It will become a 3D structure and it will become a ridge. Like this here, it is a ridge now. The line becomes the ridge. Okay. This is the stage 2. And here also we can see the ridge. Now coming to stage 3. In stage 3, there is formation of vessels on the ridge. There is, that is, extraretinal neovascularization can be seen. Okay. So here, if this is the ridge here, upon that we can see neovascularization. So this is stage 3. Now coming to stage 4. Now before we see stage 4, the new vessels which are formed are incompetent and will exudate, and also there is fibrous growth, right? Fibrous proliferation. So there is a retraction force on the retina. This will lead to retinal detachment. So in stage 4 we see there is subtotal retinal detachment. This is incomplete retinal detachment. Under stage 4 we have two subcategories, that is 4A and 4B. 4A is the one which doesn't involve the macula, and the 4B involves the macula. So we will see stage 4A. Here we can see the macula and the macular retina is still attached. So this is stage 4A and it doesn't involve the macular area. So now the 4B, here we can see the macular retina is detached. Hence it is 4B. It involves the macula. Next is the stage 5. In stage 5 we see there is total retinal detachment. That is, this total retinal detachment is always funnel shaped. Okay. This funnel shaped is created because the retina is always attached at the optic disc and detached everywhere else. So it creates a funnel shape. Okay. In this diagram also we see it is detached. In this diagram also we see it is detached at one place here, and it also occurs the same way here. So there is creation of funnel shape. Okay. Now coming to zones and the extent. See, we will see a diagram here. This is the retina, again the right retina. This is the optic disc, this is the fovea. So now keeping twice the distance between the optic disc and the fovea as the radius, we draw a circle. This represents our zone 1. Now the distance between the optic disc and the nasal ora, this is the nasal ora and this is the temporal ora, right? The distance between the optic disc and the nasal ora is taken as the radius, and another circle is drawn. This is our zone 2. Okay, now the left out temporal arc. This is the left out temporal arc. This is zone 3. Okay, this is how we divide the zones. Now to divide the extent, we divide the whole of retina into 12 clock hours, same as a clock. So here 12, 3, 6, 9, in between 1, 2, 4, 5, 7, 8, 10, 11. So now whole of retina is divided into 12 clock hours. For example, if two quadrants, that is 2 quadrants of the retina are involved, it can also be said that 6 clock hours are involved. Now coming to some clinical terms which are used while evaluating the disease. The first one is the plus disease. Plus disease is when there is venous dilation and arteriolar tortuosity in at least 2 quadrants of the posterior pole. In association, we also see neovascularization in the iris and hazy vitreous. So this plus disease is denoted as a plus sign, and now the treatment becomes mandatory. Okay. So this is a diagram representing the plus disease. In this we can see tortuous arterioles and the dilated venules. Okay, so this is the plus condition. Now coming to pre-plus disease. Pre-plus disease is less than that of plus disease. Okay, in this also we see venous dilation, arteriolar tortuosity, but so it is something like a intermediate condition which is in which there is dilation and tortuosity more than that of normal but less than that of plus condition. The next clinical term is threshold disease. The criteria to satisfy the threshold disease is there should be ROP stage 3. Upon that it should be a plus disease involving the zone 1 or the zone 2. The extent being it should involve 5 continuous or 8 discontinuous clock hours. Okay. This threshold disease should be treated within 72 hours. Immediate treatment should be given. Now coming to pre-threshold disease. Everything less than threshold is pre-threshold disease. Under pre-threshold we have two subcategories, that is high risk and the low risk. The high risk is called type 1 ROP and the low risk is called type 2 ROP. We will see the criteria which satisfy type 1 and type 2. In the type 1 ROP first, we have 3 criteria. Okay, the first being any stage in the zone 1, any stage in the zone 1 with a plus disease. Okay. The second criteria, a stage 3 disease in the zone 1 without a plus. Okay. The next being stage 2 or 3 in the zone 2 without a plus. So it requires treatment within 48 to 72 hours by laser photocoagulation of the avascular retina. Okay. Now coming to the low risk, the type 2 ROP. Okay, in this we have two categories. In the two categories also we have common criteria which is without a plus, that is low risk one. Okay. In the first one we have stage 1 or 2 in the zone 1 and the second one stage 1 in the zone 2. This requires only follow up so that when it reaches a stage of type 1 ROP, that is high risk ROP, it can be treated. Okay, now coming to another clinical term called APROP. APROP is aggressive posterior ROP. It is also called rush disease because it rushes to stage 5 directly. Okay, it is severe type of plus disease. Okay, in the zone 1 or the posterior part of the posterior zone 2. Okay, what happens in this? In this there is flat neovascularization mainly. This is the main point. Here we can see this is the diagram for APROP. You can see that neovascularization occurring flatly, flat proliferation of vessels. Okay. So now there is flat neovascularization and there is hemorrhage and as I said, it is a rush disease, absence of any stage and directly presents as stage 5. Hence immediate treatment is required in this case in APROP. Now coming to differential diagnosis. ROP can be classified into active ROP and also advanced ROP, advanced or cicatricial ROP. Now we'll see the differential diagnosis for both. The ongoing or the active ROP should be differentiated from FEVR, that is familial exudative vitreoretinopathy, which also shows neovascularization and also avascular retina. So and then incontinentia, second one being incontinentia pigmenti, which is mostly seen in girls. It also presents with neovascularization in the retina. Now the advanced ROP or the advanced ROP or the cicatricial ROP, in which this is something more than that of stage 3, that is stage 4 and 5, in which there is retinal detachment. It should be differentiated from other causes of leukocoria, as due to retinal detachment the pupillary reflex will be white in color, that is leukocoria. So it should be differentiated from other causes of leukocoria. Now coming to the management of ROP. Under management of ROP, we will see the screening protocol and the treatment protocol. Okay. So now first under the screening, when should be the infant screened for ROP? When the premature is born, as such, he doesn't show any clinical features of ROP, as it is a progressive disease. Okay. When the infant starts growing, then he shows the clinical features of ROP. So screening has to be done. The first ROP screening has to be done at 3 to 4 weeks after birth if the gestational age is 28 to 34 weeks and the birth weight is less than 2000 gram. Next, it should be done 3 to 2 weeks after birth if the gestational age is less than 28 weeks and the birth weight is less than 1200 grams, 1200 grams. Okay, now coming to ROP treatment protocol. the ROP treatment protocol is given by ITROP group, that is early treatment ROP group. Under that we see laser treatment. There is laser photocoagulation done using diode laser of 810 nanometer, or frequency doubled Nd:Ag laser is used with the help of LEO, that is laser indirect ophthalmoscope. It is carried out in all patients with high risk, that is type 1 high risk pre-threshold disease, threshold and aggressive ROP. This is everything including the stage 3 and below, that is there is no retinal detachment here, okay, in these cases. Okay, now coming to the post laser treatment. After the laser is done, there are antibiotics and steroid prescribed, and also there is subsequent follow up done at 3rd, 6th and the 12th weeks after the treatment to see if any complications develop. Okay, now coming to surgical treatment. Under surgical treatment is required for all the stages, like in which there is retinal detachment, that is 4A, 4B and stage 5. Okay, under surgical treatment we do lens sparing vitrectomy. Lens sparing vitrectomy is done with endo laser photocoagulation. This is done to cauterize the retinal tears, and then retinal reattachment measures are taken. Okay, this is for stage 4A, 4B and stage 5, as I have already mentioned. This is the surgical treatment. Okay, thank you.